who are waiting. They've had their first shot and they're waiting either 15 or 30 minutes so they can get on the golf cart and be taken back to our cars. Also, while they're panned out, I want to introduce to you our incident commander, Chief Rodney Smith of the Cedar Hill Fire Department. Here at Fair Park and at all of the locations, it is truly a community-wide effort. We have the incident command is from the city of Cedar Hill. We have vaccinators from the city of Dallas and Irving. The volunteer coordinators are from the city of Carrollton, and many, many others that are involved in this, as well as our Baptist men who feed everyone, our Lions Club who do so much with the volunteers. I'm going to give you news today of how to increase your chances of getting one of these early vaccines. Before we do that, there's been something that's been on my heart and on the hearts of many others that's not vaccine related, and I want to briefly tell you about that. It is a funding opportunity that we would ask you to consider. So on January 6th, we watched as the United States Capitol was attacked by insurrectionists whose sole mission was to stop the certification of the electoral votes presented by the 50 states and thereby the peaceful transition of power to the elected president. The rioters that stormed the Capitol and the domestic attack resulted in the deaths of 2 Capitol police officers and the injury to many others with the U.S. Capitol Police Force. I, along with many others, wondered in the following days, what could we do to honor the sacrifice of those who were injured, scarred, or gave their lives to protect our U.S. Capitol and our democracy from that mob? How could we show our gratitude in North Texas for their sacrifice? Today, I, along with Congresswoman Eddie Maurice Johnson, Congressman Mark Vesey, and Congressman Colin Allred, announced the creation of the North Texas Cares for U.S. Capitol Police Fund at the Community Foundations of Texas. The purpose of the fund is to provide funding for the U.S. Capitol Memorial Fund, overseen by the U.S. Treasury, that provides financial support to families of the U.S. Capitol police officers who were killed in the line of duty and those who have sustained serious line of duty injuries. To learn more about the North Texas Cares for U.S. Capitol Police Fund or to make a donation, you can go to the website behind me, and I'll also post that on my Twitter at Judge Clay J. And we would encourage you to donate. I have, and I hope you will as well. And now, while I'm very grateful for the hard work of the healthcare heroes, first responders, volunteers, and others who have successfully vaccinated over 124,000 of our Dallas County healthcare heroes and most vulnerable residents in less than a month, I recognize that there are many people out there who are in desperate need of a shot who have not had the opportunity to get one yet. Now, just in the past 14 days, we've given a little over 28,000 shots right here at Fair Park. We've been open 14 days. Some days we're closed because we're out of vaccine. But in the days we've been open, a little over 28,000. And we think that's going to accelerate as we get more vaccine. Please know that our teams are working day and night to improve this process every day. And we're trying to make it better for you every day. We recognize that for some, it's been a pretty bumpy process for them. And so we're looking to improve that. And I'm going to lay out for you, after I tell you how to get in line for perhaps a faster vaccine, I'm going to lay out for you some of those improvements. But first, I want to give you some news that you can use which will increase your chance of an early vaccine. So if we could switch to the list real fast and then we'll put this up. Yeah. So you may not be able to see this list, but I'm only going to leave it up there briefly. But this is a list of all the hubs in North Texas, okay? Now, I realize you probably can't see that, so switch to the QR code. QR code. Okay, so if you don't know how to use a QR code, I'm going to tell you a little bit about this, but what you're going to want to do is while you're watching this, if somebody, don't look at me right now, zoom in on that QR code, and if you'll aim your phone like you're taking a picture at that QR code, it will open for you the Department of State Health Services Vaccination Hub page, okay? Let's forget about me for a minute and just stay on the QR code while I tell people this. If you can hear me, I guess you can't see my lips anyway. All right, so I would encourage you while I'm telling you about this to get on that and save that link, okay? Any resident of Texas, citizen, non-citizen, your driver's license says California, but you live in Texas, it doesn't matter. You can register at any of our state's vaccination hubs that you're willing to drive to, all right? So the fact that you live in the city of Denton doesn't mean you can't register in Collin or Tarrant or Dallas County. Similarly, if you live in Dallas, you could register in any of those other 3 counties. But there are also other lists, other than just the 4 big counties, where you can get a vaccine that are maintaining their own list. These include the vaccination hub led by the city of Garland, the vaccination hub led by the city of Allen, and the vaccination hub for people who want to drive that far, led by the city of Tyler, that are all here in North Texas. Now, most of the county hubs are pulled, the names are pulled by several entities within that county. For instance, in Dallas County hospitals, UT Southwestern, Parkland, and Baylor all pull from that list, as does the city of Dallas and, of course, Dallas County. In Tarrant County, I don't know the full list of everyone who pulls from it, but I know that THR, Texas Health Resource, the city of Arlington, and Tarrant County at their site in Hearst and perhaps other sites pulls from their list. So again, you can register at any hub. Now, why would you want to do that? Well, right now the state does not have a website where you can register at all of them. So even though it's tedious, if you want to, you can go register at all those and increase your chances. Now you need to understand your chances may be better depending on who you are on one rather than the other. Let me tell you what I mean by that. Some hubs use a model of vulnerability and proximity. In other words, they look at what zip codes have the most COVID spread and what people, with a heavy emphasis on those zip codes, but what people are most vulnerable to a bad outcome should they get COVID. And Dallas County uses that model. That means if you're 45 years old, the more 75 and 65-year-olds that sign up, and people that are older or sicker than you on the list, they're going to get priority. It's not first to sign up, first to get a shot. Some counties and hub providers go, if you are in 1B, if you are qualified in 1B, then it is first to sign up, first to get a number to get a shot. Some hub providers use a hybrid of that. For instance, first person over 65, if that's their group, to sign up is the first one to get a shot. So signing up at all of them, as you're legally allowed to do as a resident of Texas, is a way to increase your chances of vaccination. And the only way to get a vaccine through one of these hubs is to register. So registration is very, very important. So again, I'm going to leave it up here for a while. We've got this QR code back here. You open that, and you'll be able to scroll through a list of all. It's in alphabetical order by provider. So, you know, it's not every provider in Dallas. There's only two, by the way, Dallas County and Garland in Dallas. But if you're looking at your county, I know there's a lot of people in the viewing audience here. So if you're looking in your area, you are going to have to also look for cities near you. You may be in Grayson County, and if you start at C, Collin County, you would miss, for instance, Allen Fire Department, that is one of the hubs. So you need to go through that list and sign up where you want to, not restricted by where you live. All right? So we'll leave that up there for a little bit. Now I want to talk to you a little bit about Fair Park, because unfortunately, here's the good news, okay? Good news is that next week we'll have a new vendor that will be fixing some of the glitches in the appointment system. We still have a problem, unfortunately, with our appointment system where people are forwarding appointment links to people that were not invited by Dallas County, okay? So we have signs on the road, and if you'll help us get the message out, and if you're hearing my voice, please know this. They're big orange signs, traffic signs, that tell you we don't honor appointments for people under the age of 65 at this location, okay? We have not sent out any actual appointments that were not an unauthorized forwarding from a third party to anyone under 65. We hope that at some point we're obviously going to try to get to that population, but we have not sent out any yet. And so if you show up and you tell us, I know I have an appointment, and you believe that you have an appointment, but you're not 65, unfortunately you won't get a shot here, and I don't want you to waste your time coming out. And I recognize that a lot of that is a glitch in our vendor's appointment system, and is you know, you may in good faith believe you have an appointment, or you may know that it was forwarded to you by a friend. But in any instance, if you're under 65, unfortunately, we will not be able to honor that appointment at Fair Park. Now, I'll talk to you in a minute about the new appointment system and how that'll be fixed. So we're going to keep working to get more vaccine supply for Dallas County, and I believe the state is doing a good job of allocating what they receive from the federal government. The Biden administration is ramping up production, and I do expect to see more vaccine supply in Texas in the very near future. We're working collaboratively with the city of Dallas, city of Cedar Hill, Irving, Coppell, and many, many others, to get you the vaccine just as soon as possible. We all share the same goal of getting these vaccines distributed as quickly, as safely, and as effectively as possible. Tomorrow we'll have another press conference here with our City of Dallas partners on important registration information. And following that, I'll be working with our federal partners, including taking Congressman Johnson on a tour of our operations. And speaking of federal partners, with the Biden administration's plan to set up 100 mass vaccination sites through FEMA, Dallas County has submitted a STAR request, which is a resource request, through the state for consideration by FEMA and the White House. Our request is for a federally run FEMA COVID-19 mass vaccination mega site that could potentially help with the vaccinating of up to 12,000 people per day to serve the 7.7 million residents of North Texas. This would be in addition to the vaccines we are currently distributing. This request is currently in Austin, and I am hopeful they will forward it to our federal partners very soon. While there are several state of Texas vaccination hubs in North Texas that serve thousands of our residents, health officials estimate that it will be summer of 2022 before we can fully vaccinate our state. The 7.7 million residents of the Metroplex make up more than a quarter of the state's population, and a federal mega site serving 12,000 North Texans a day would dramatically decrease that timeline. Based on conversations I have had with the Biden administration, we are encouraged that they will give serious consideration to our request to partner with Dallas County on this federally led public health initiative of a mega vaccine site. Now, yesterday, the Commissioners Court unanimously approved 3 contracts to assist with our countywide vaccination efforts and to increase efficiency. We'll be hiring a vendor to manage the vaccination registration process and everything from appointments to collecting data, and that'll be utilizing QR codes like the one behind me. You'll get a QR code, obviously different from the one behind me, but you'll get a QR code, and so you won't be able to forward that, right? If Joe Smith shows up with Sarah Johnson's QR code, we're gonna know that's not Sarah, and that's gonna fix that problem. It's also gonna allow all of the process that's currently being done by hand when you have to fill out paperwork to be done online, and that is going to double our throughput. We need more vaccine to fully take advantage of that, but we can double our throughput and cut down on our wait time, as well as make sure that the people who get the shot are the people that the doctors say are the most vulnerable people from the most vulnerable areas. We're also aware of the significant call volume to our COVID vaccine registration hotline. So we entered into a $4.3 million contract last night to hire a call center with bilingual staff to handle the increased volume and to ensure our residents without internet access can have equal access to registration. We will have more information on that, as well as rolling out a new toll-free number once that is fully operational. You'll, for now, continue to use the number that we've given to people with county employees trying to keep up with that demand. And lastly, the Commissioners Court approved a partnership with a local media company to assist with communications, messaging, and to help us reach all the residents who are looking for more information on the vaccine. Our goal is to have better customer service for our residents of Dallas County and North Texas, and I believe these 3 contracts will greatly help to achieve that. I want to talk to you for a moment about scams, because it is an unfortunate nature of situations like this that dirtbags will come up and try to scam you. So anyone that would try to take advantage of others during a global pandemic is, as I said, a dirtbag. And when we find you, we will prosecute you to the fullest extent of the law. And so I want to tell you about some of those scams. Let me be clear. No legitimate vaccine provider will call you and offer you access to the vaccine for some form of payment or ask you to pay out of pocket for the vaccine. The vaccine is being paid 100% by the federal government. There is no copay unless you have insurance in a few instances, but there's never going to be an instance where anyone should ask you to actually give them money for the vaccine. And do not give out your personal identifying information to anyone over the phone if you did not initiate the call. If you call our Dallas County vaccine registration hotline, they will ask you for personal information, and it's safe to provide that. If you call us, we won't call you. If someone calls you and they say, I'm in Dallas County, I'm with your doctor's office, the hospital and I need your personal information. If you don't know them, follow your instincts and hang up, because Dallas County won't be calling you asking you for your personal identifying information. We'll only help you if you call us. Okay, so please remain vigilant and protect your personal information. If it seems questionable, trust your instincts. Now is the time we must all continue to make these small sacrifices of patriotism to keep ourselves, our community, and our country strong in this time of high spread. Yesterday was our deadliest day for COVID on record, with 40 deaths in one day here in Dallas County. Today we announced 37 more deaths. Last week was our deadliest week with 138 deaths, and we're on pace to far exceed that this week. And so we are seeing some encouraging news, a little bit of a drop in hospitalizations, but it's up to all of us to do the things that doctors have told us about over and over again to keep us safe in this time. And then what will happen is, beginning in March, it's going to get a little bit better, because some of these healthcare heroes are going to be vaccinated, and all of a sudden we're going to be playing at 100% strength at our hospitals, as opposed to having 1,000 people out every day with COVID. And our nursing home residents and our most vulnerable seniors aren't going to be filling up the ICU beds, because we're going to get them vaccinated. And then each month after that, it's going to get better if we make those good decisions. And we can do this. And then we're going to beat this thing by everybody working together. You've got to do your part. Your part is to get registered as many places as you're willing to go to get the vaccine, to help your family and your friends and your employees, whatever, get registered, and then to do those things the doctors tell you to do to stay safe. And together we're going to beat this. And now I'm going to turn it over to Dr. Huang. Thank you.
Good afternoon. As the judge mentioned, we're still seeing really high levels of COVID activity in our community. Today, I think we're reporting 1,637 new cases and 37 deaths, which is tragic. Again, these are some of the highest numbers of deaths, and last week was a record number for the deaths. However, the spike we saw probably after the Christmas and New Year's and Thanksgiving holidays, it does seem like things have plateaued a little since then. And so since mid-January, things have leveled it off. I think it's more the baseline level of activity as opposed to what we were seeing during the holidays. So it's flattened out, but it's still at record high and very high levels. The hospitalizations, and I'll show you in a second some of the numbers, but there's hospitalizations still very high. ICU bed occupancy still very high. And as we saw last summer, ICU bed occupancy can go up really high very quickly. So it's still very fragile. And so it just reinforces, again, why we need to keep masking, avoiding crowds, staying 6 foot physically distant, washing our hands, and those things. One thing let me go through this slides real quick, and then I have one other thing. So again, this is the ICU bed availability. Again, it's still very low ICU bed numbers. The latest number is 40 in Dallas County of ICU bed availability. Next slide. This again, the emergency department visits in the prior 24 hours. You can see we saw the increase in September, but it has flattened off and slightly dropped a little in the last few days. Next slide. This is admissions in the last 24 hours. Again, we were peaking probably mid-January. It has started to come down a little, reflecting what I was talking about. And then this is the hospital occupancy. Again, that you see that flattening over the last week to two. Next slide. But this is the deaths, and these lag behind, but you can see we had that big spike at the end of December, and some of those numbers, again, given some of the recent numbers that we've been reporting each day, are probably going to go up as the numbers catch up. I just want to talk briefly A couple of things that have been questioned regarding, there are questions coming out regarding the vaccination, how people get their second shot. If you received your first dose of vaccine here at Dallas County Health and Human Services or at Fair Park, you don't need to re-register or you don't need to schedule an appointment to get your second dose. You should have received a vaccination card. It actually looks like this, and it should have included the date that you need to come back for your second dose. So come back to Fair Park on that date around the same time that you got your first dose, unless you hear anything otherwise. But you come back on the date that's on your vaccination card around the same time that you got your first dose. Bring your vaccination card and show it to the security at the gate, and they'll let you in. This is only for people who received their first vaccine either at Dallas County Health and Human Services or at Fair Park. If you got your first dose somewhere else, then you need to contact the place that provided that first dose to get your second shot. The state is automatically allocating the second doses to the locations where the people got their first shot, and so those allocations are supposed to be made to those providers. So again, for example, if you received your first dose at a local pharmacy, we recommend contacting that pharmacy to schedule their second dose. At this time, the state is only giving the health department enough second doses for the people that we administered those doses to, those first doses. So currently we don't have enough vaccine to give second doses just to the general public. Other thing, we've had now 4 cases of the B117 variant identified in Dallas County residents. This is the same one that was seen in the United Kingdom. It does spread more easily and quickly than other strains of coronavirus. It spreads in the same way, so what it really does, and it's predicted perhaps that it might be the dominant strain in the U.S. by March. So what we have is an advantage that we have advance warning about this, and so just reinforces it's more important than ever to keep wearing the mask and physical distancing, staying home when you can, and doing those things to slow it down. So that's all I've got, and turn it over.
So if you have questions about the operations here, you can also ask our incident commander, Chief Rodney Smith. I'll answer any questions anybody has. Of course, Dr. Wong can answer questions as well. Go ahead, Kevin, I'll try to repeat it.
What is your time frame, the expected time frame for the incredible assistance that you're asking
Sure.
for additional vaccines?
So the question is, what is the expected time frame for the federal assistance that we are asking for the mega hub? So President Biden put out a 200-page report. I can't remember when this was. I read that, within an hour. Started reading it within an hour of it coming out. Saw the opportunities for a mega hub, and began conversations with the highest levels there at the COVID response. What they're doing now is they have to stockpile vaccine, keep up their vaccine that they're giving to the state, and actually increase that, and then do another stockpile for these mega centers, okay? And not just here, but perhaps other places as well, other major urban areas. And so that stockpile could be ready by the second week in February. And my hope is that we will work on this and get something done there. I want to stress that until either the White House or FEMA announces it, it's not a done deal, and we don't have a deal yet. But things are moving along very quickly, and we're hopeful that we will be able to add that force multiplier, which, to put that in perspective, if you ran that for 6 days at 12,000 people a day and took Sundays off, that'd be 72,000. And this week, our total vaccination for everyone in Dallas County is 43,300. So it'd be quite a force multiplier if we land that.
Make that
Sure. So the question is, have we specified a location, and why do we have to send it through the state? Okay. The first question is, we have a preliminary location that we have to put in there, but then the federal partners, once they decide to do it, will send military scout teams down and choose their permanent location. So we shouldn't get too wrapped up on location yet. The second question is, why is it that you're having to send it through the state? So the law requires, the federal law requires that resource requests go through the state of Texas. And so we have sent the resource request. I expect that, they've had it there for at least 2 or 3 days. I expect that they will forward that very soon. I know our federal partners are waiting for it, and so once, we'll continue working on that once it's forwarded.
What can you tell the person who feels singled out, feels I'm not getting the help that I need? Obviously, there are priorities. Obviously, a lot of people aren't. What can you tell that one person?
Sure. So the question is, what can I tell the people that are singled out and feel like I'm not getting the help that I need? What I can tell you is I understand that for all of our people, what is important to you is how do you and the people that you most care about get an opportunity to get vaccinated just as soon as possible. And we are working night and day on that. And what you can do to help us is register in as many places as you're willing to drive to get a vaccine. And then do those things that will keep you safe until we can get you a vaccine. But I do understand it, and you deserve a vaccine, and we are working night and day to get you one.
Is there a way when you're kind of shopping around for those spots, best place to get your vaccine and registering in these different places, is there a way to find out maybe which one has the smallest waiting list? For example, Dallas County has 400,000 people, let's say, on it. Is there a way to find out, Collin, or even though Tyler has a lot less, is there a way to gauge where do I have my best shot?
Okay, so the question was, is there a way to find out how long the waiting lists are, and to find out, in essence, where do I have my best shot at getting a shot? And unfortunately, again, there's not a state website with that information on it. You would have to actually, if you wanted to know that, then you would have to check with each individual hub, right? It does not take very long to register for the vaccine. If you have an internet connection, it only takes less than 5 minutes to register at Dallas County, and I believe the same is true at each of these hub sites. For instance, a friend of mine got on the list right when the Allen Fire Department began giving shots, and he lives in Dallas County. He's one of the first people to get one. Similarly, we've given shots here in Dallas County to people from Collin County and every other county. So unfortunately, there's not an easy way to do that. The easiest thing to do is if you're willing to drive a few minutes to Garland, if you live in Dallas, or Collin County, or Denton County, or Tarrant County. Same is true if you live in Tarrant County, right? Then you register at all the hub locations. And again, remember, in Dallas County, if you are very vulnerable from a high spread zip code, you have your best chance, whether that be a high spread zip code in Dallas or somewhere else, whether you're an 85-year-old or a 65-year-old on kidney dialysis. Those are the people that are getting the appointments currently in Dallas County. If you're not one of those folks who has a very, very serious condition like diabetes, like kidney disease, like you're way over 300 pounds, or you're not over 75 years old, you may have a better chance on a first come, first served list. Now, here's more news you can use for you vaccine hunters, okay? If you sign up when a new hub is announced that is using their own list, right? Most hubs are are not doing that. Most hubs are using the existing list and drawing from those. But when a new hub is announced, and if that hub turns out to be a first come, first serve, then you've got a great chance of getting in there. Now, let me tell you one other little piece of news you can use from a call that I had today with the state. Because of the vaccine flow, and again, I think the state of Texas is doing a tremendous job of getting that vaccine out of their hands and into our and other people's hands to get to you. But because of vaccine flow from the federal government, the state will not have any new hub providers for next week. So if you remember 2 weeks ago, they added Garland and Baylor here in Dallas County and others in the other big counties. And then last week they added the city of Dallas, and we're giving shots, at K. Bailey Hutchison today for the first time there. Next week, no new hubs. Look for the week after that, though, for new hubs, and sign up on the hubs as they become available.
How many unauthorized appointments have gone out? And is it the same vendor that you had since the beginning of Fair Park? You finally decided to switch vendors?
Yeah. So it was very bad in the beginning. People were able to post links like on Nextdoor, send them out in newsletters, and that link would work for anybody that wanted to use it. The vendor thought they fixed it. I don't want to get too much into the details of how you beat our system. The question was how many unauthorized links are still being shared. So don't want to get too much on how you beat our system, but suffice to say that we have sent out thousands of emails, either the county or the city this week, to people who made appointments who clearly don't fall in the parameters of who we're doing right now, which are people over the age of 65 with serious health conditions and people over the age of 75 regardless of condition. Okay? Any other questions? Question for Dr. Wong.
We haven't heard that. I mean, we've been using up all the doses they've given us and told them we'll take more. So, I think that there is some reporting lag still. A lot of our data have to hand entered all the data and get in through the state. So I don't know if that's part of the lag, but I can tell you we've been using everything that we get, and so I don't know exactly. I haven't seen that data. The question was about, sorry about that, the question was about the distribution. Some counties, state released some data that showed some counties were having, I guess, less coverage or less people vaccinated in their areas, but okay.
Did you say 1637 today?
Yeah, 1637 new cases. That should be coming out shortly.
Before we take another question, I'm going to ask Chief Rodney Smith to come up, who is our incident commander, and tell you about our drive-through opportunities for the mobility impaired. Chief?
One of the things, when we started the operation, we were strictly kind of a walk-up site. People were parked in the parking lot. We would shuttle them up to the buildings, and they would come in to get their vaccine. One of the things we noticed that every day we kind of go over the operation and look at how we can improve. One of the things we noticed that people with mobility issues, that it was tough for them to get on the golf cart. So as of Tuesday of this week, we've also started a drive-through location that's located out in parking lot 5B. So anyone with mobility issues, we can drive them through a tent we have out there and actually give them the vaccination in their vehicle. So a much needed improvement, and so definitely something we wanted to get out, that we have that capability now. So.
Anything else, guys, before we wrap up?
Judge, I just wanted to ask, you said that 2022 is when it's believed that everybody can be vaccinated by. That's the timeline. Is that mainly because of vaccine supply and
Yes.
getting more doses?
So the question was, the current trajectory of 2022 to get everyone vaccinated, where do you come up with that? And I don't come up with it, others come up with it, but where do they come up with it? That's based on the current trajectory of vaccine. And it includes some modeling for more being, approved. But there's a lot of reason for optimism. It's why we need people, particularly if you're over 65, to register. And by the way, at Dallas County, we are open to registration, whether you're a 1B or not. Now, you won't get an appointment if you're not a 1B, but we want to go ahead and get as many people registered as we can so that when we get to your group, you're already on there. But, there's a lot of reason for optimism. The Biden administration is working on a contract for an additional 200 million doses. So that would be 100 million people, because it's 2 shots, from Moderna and Pfizer. Johnson & Johnson, which is also in collaboration with a company called Janssen, is going in front of the FDA for approval in mid-February. That is a 1-shot dose if it's approved. Now, early on, because of their agreements with other countries, there won't be a whole lot of Johnson & Johnson for the first few weeks. But once we're able to really get that ramped up, their production lines, if they're producing as much vaccine as Pfizer or Moderna, will be producing enough vaccine for twice as many people because it's a 1-shot vaccine. So we're going to get this done. Now that the president has invoked the Defense Production Act, and this has the full attention, Dr. Fauci and others are able to lead the response without any fear of politics. This is going to get done. Your part is to register and just do what the doctors are asking you to do about masks and crowds and washing your hands a little while longer until we can beat this thing. Are you asking about registration or transportation? Okay, but so I can repeat the question, is that about getting them to register so we can get them here, or a bus to get them here? Okay, so the question is, what is your outreach to hard to reach neighborhoods, particularly Black and Latino neighborhoods, who have are on the wrong side of the internet divide, who have some reluctance to get vaccinated or have not heard about this, all right? And so again, what we've done so far, you got to remember we had to kind of build this immediately to get into the state's mass vaccination hub. So we did that in 4 days. And at first, all you had was a website. Now you have a phone number that you can call, and let me grab that for you real fast. You texted it to me? Okay. Hang on 1 second. And that phone number, until it switches next week to the 800 number, is 469-749-9900. That's 469-749-9900, and I hope people will put that on their newscast. So they've got that. And then we got partnerships with school board members, city council people, mayors, church leaders, business leaders, to get people registered, to get into those hard to reach communities and get them registered. And we approved yesterday an advertising contract with a group that is skilled in reaching out to English second language, to African American communities, to different people for each of these things, different companies for each of these things, and the Latino community and other hard to reach communities. But it takes all of us. And by the way, let me say this, because that's a very good question. Anyone can help register people. All you need to help register people is a hotspot and some devices, whether they be tablets or PCs, and you can register just like you can register your grandma. You can register people in the neighborhood on our website, so that they'll be on the vaccine registry. And so we're asking people to partner with us. You can contact my office if you're interested in joining a registration effort in your neighborhood. Okay, is any last question? Anyone? Great. So again, thank you all for your time and your patience. I cannot thank all the volunteers and all of the first responders and healthcare heroes enough for the great work that they're doing. I am so proud of them, and they are so dedicated to you. So do your part, please. Stay safe, get registered, and let's whip COVID. God bless y'all.